It started when I was in high school. I was on the rowing team, and I was seeing that not only myself, but also some of my friends, some of my teammates were getting injured. And I wanted to know, how can we prevent this? And if this does in fact happen, is there any sort of way that we can correct it? It led me on a path of pursuing my undergraduate degree in exercise science. What made me choose Columbia? Columbia is a school for dreamers, for people that are meant to evoke change in the world in some way, shape, or form. And when I actually went for my interview that first time, I was inspired by the people that were surrounding me. Every single person in the room exuded this ambition, this drive and passion for what they did, and it said to me, I need to be here. These were brilliant minds, and I wanted to work so in depth with them. When I was at Columbia, I was absolutely captivated by the neuro courses. I chose the adult neuro rehabilitation course, and that introduced me to a plethora of doctors and different experiences. And so it really opened my eyes to different disorders that may be happening, or illnesses, or undiagnosed mysteries, which I loved. The one thing about neurology in general is that there will never be a black and white answer. It's always gray. And it's always evolving. So you learn one thing, and that may change something that in the way that you're directing care for your patient. It keeps you on your toes, and I love that. I love the fact that with neurology, there's this investigative piece to it, and that's what captivates my interest and captivates my mind. I decided to pursue a neurologic physical therapy residency, and I'm absolutely honored to have been selected as a candidate for admission here at Boston University. At the Boston University Neurologic Physical Therapy Residency, we tend to wear multiple hats. We're involved in conducting research. Then we also teach, whether that be to the Boston University Doctor of Physical Therapy students or to the communities. So we go out into the communities and we're teaching them, like individuals with Parkinson's, things about balance, or how can physical therapy help you? And we try to bridge that gap between practice and the community. And then beyond that, we have quite the clinical role. We essentially work at 3 different places. So one being Beth Israel Deaconess Medical Center on an inpatient floor, and then also in the intensive care unit, or the ICU. We have 2 outpatient facilities that we work in. One being Spalding Rehab Center in Medford, and that has an outpatient neurologic practice. The final one is actually here at Boston University in the Center for Neuro Rehab. Columbia really prepared me in terms of my practice now. Beyond the academics, I had a support team. I had this wonderful group of professors, of students, of alumni that were supporting me in the goals that I wanted to seek. And I would never have gotten that in another program. In 5 years, I see big things for myself. Like I said, I tend to be someone that's a dreamer. I have multiple goals, and I see myself half in clinical care, half in research. I really would love to develop my research more, and particularly in the neuromuscular diseases section. Additionally, I can see myself pursuing a PhD. I would love to do that. My name is Chelsea Macpherson, and I am a Columbia physical therapist.